Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Loud too. So.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and tonight we have Dr. Dennys Reyes, and he is an interventional neurologist. And you can find him right here in Palm Beach Neuroscience Institute, 2 different locations, 8756 Boynton Beach Boulevard, Suite 2500, and the phone number is 561-499-7551. And then the Delray location, 16215 South Jog Road, Suite 204, Delray Beach, Florida, 33446. Thank you so much for joining us today.
Of course, thank you for having us.
I appreciate you coming.
You.
And so, Doctor, can you share with us a little bit more? Who would I recommend to you? If you're an interventional neurologist, how would I know, like, I know so many people. What type of patients do you see?
Yeah, I'm still a neurologist, but the term interventional basically makes it a little more specific for procedure-based conditions. So brain aneurysms, for example, patient with strokes or brain bleeds that are unexplained, that we don't know why the bleed happened to begin with. Oh. Most bleeds happen because of high blood pressure, but sometimes we don't have a good explanation. So we do a procedure to going through the groin with catheters and wires, and we study the vessels in detail and try to figure out what's happening with the vessels, something that could explain, the condition that the patient is suffering with. And then try to treat it, of course. If there's a brain aneurysm, that's something I see very frequent. Strokes, patients suffering from strokes, carotid occlusions or narrowing in the stenosis in the carotids as well, or in the arteries of the brain too. Yeah.
So let's take a couple of steps back. So how would somebody know that they are going to have a brain bleed, or they are a candidate for this type of health concern? Are there any signs or warning signs if somebody has a brain bleed, and does that lead to seizures?
It all seems, just like you said there, it's somewhat interconnected. Having a brain bleed is high risk for seizures, but how can you predict that you're going to have a brain bleed? That's very difficult, actually. Overall, the spectrums with strokes, 87% of strokes are usually ischemics, meaning the vessel is shutting down, and there's lack of blood flow in a part of the brain, and only about 13% of patients will actually have a bleed, unless they fell to the ground and had a bleed because they had a trauma to the head. So it's really hard to predict that they're going to have that. But certainly they can prevent it by taking care of the risk factors: blood pressure, cholesterol, sugar problems. Someone with those 3 risk factors, let's say uncontrolled, high blood pressure uncontrolled, sugar uncontrolled, and also cholesterol, they will have a high risk to something like this, a brain bleed, even a heart attack, right?
Right, of course, sure. That's the high risk category.
Yeah.
So, do you get referrals from other doctors, or can we see you? Can someone see you directly without a referral?
Typically, I think they do need a referral from primary doctors, but there are some leeways. There are certain scenarios that I believe they won't need a referral. That's not my expertise, but yeah.
So would a person need a CAT scan to detect? Because I actually have a friend who just found out she has a brain blade and had a seizure.
Oh, really?
That's why I'm asking.
Gotcha.
And so I think she was getting some type of a scan.
Yeah.
If I remember correctly, some type of CT scan or something?
CT scans are pretty good actually
Are they?
for when the bleed is very recent, very fresh.
Okay.
Let's say the typical scenario is somebody with a severe headache, worst headache of their life,
Oh,
and they have
wow.
nausea and vomiting.
Okay.
Now they can also have weakness on one side of their body, they can lose their vision, they can have speech problems or dizziness, you know.
It sounds like a stroke almost.
Yeah,
Similar, no?
they all kind of
Yeah.
sound, but when they have nausea and vomiting and a
Oh.
lot of headaches,
Okay.
it usually has a tendency towards a bleed kind of scenario. So when you do a CAT scan right away, you can actually see the
Okay.
bleed there.
Oh, okay.
The MRI is actually a more detailed tool
Mhm.
and you're more refined. You can measure the bleed and get the volume of the bleed a little better. You get more information from an MRI.
I see.
But for a CAT scan it's pretty good,
Okay.
pretty good tool to begin with.
Yeah.
You know?
So this is my question, and I always seem to want to ask. Actually, I want to give our phone number out. If anybody's listening and you want to call in and ask Dr. Reyes any questions, please call 888-994-4995, Studio A as in Apple. I'll repeat, 888-994-4995, Studio A. He'll be able to answer your questions. So my question is, I know you said high risk, you know, cholesterol, sugar, and high blood pressure. My question is, what are as far as genetics are concerned, what if a person doesn't necessarily have those factors?
Those factors.
Could this be genetic? Like, for example, my mother unfortunately had an aneurysm. I know she
Right.
had high blood pressure, but I always wonder, is that genetic or how does that work?
We haven't been able to identify a specific gene yet,
Okay.
you know, to correlate, to consistently find in every, you know, patient that has a brain aneurysm. We do know that there are certain susceptibilities, like having polycystic kidney disease.
Oh.
You know, somebody carries kidneys that has a lot of cysts.
Interesting.
That condition itself seems to be linked to a higher risk of having brain aneurysm. It doesn't mean that you're going to have it.
Right, but you have a higher risk.
A high risk, yeah. Or you have a sibling, yes, a direct family member
Okay.
that suffered from a brain aneurysm in their past. I recently had a patient to the hospital, and her mother had a brain aneurysm.
Wow.
But there's no way for us to prove
Right.
genetically,
Right.
you know, that
Sure.
they're linked. But we know there's a tendency, I would say, that could
Sure.
potentially run in the family, yes, yeah.
Makes sense.
That along with smoking. Smoking is a big
Oh,
factor.
yeah. So back to lifestyle.
Yeah,
again,
back to
right?
lifestyle
back
again,
To
you know,
lifestyle.
so-
It's always
That's what-
about that healthy lifestyle.
Pretty
I
much,
mean,
yeah.
I know that you see a lot of patients. What is your experience with patients who have a healthy lifestyle, you know, eat moderately, exercise,
Yeah.
versus patients who maybe don't have a healthy lifestyle?
Well, I see them all the time because they're 90 years old or
Yeah,
more. So
wow.
somehow they're doing, you know, they're doing good.
Wow, nice.
So, but yeah, the younger folks can run into trouble, of course, when their blood pressure is uncontrolled. You know,
Sure.
having a systolic blood pressure in the 140s for over 10 years, 20 years can cause more problems than having, you know, blood pressure up to 180 one day or 200, you know,
Sure.
for whatever reason. But yeah, that's the big scenario. But yeah, blood pressure is one of the biggest. 80% of the strokes are related to blood pressure problems. 80% of the strokes that we see is usually blood pressure related. Yeah.
So, if we take it back a notch, why is it that a person is suffering? I know I'm asking you questions. You're probably like, there's a million answers to all these questions, but
Of course.
you know, like, why is it that somebody who's relatively healthy, for example, eat decent, they eat okay,
Yeah.
and they seem to be in good shape, they work out maybe a
They
couple
work
times
out,
a week,
run into
but maybe in their 40s, why do they have high blood pressure? Is it stress? Is
Yeah, I mean, stress is a big factor,
Yeah.
of course. Not having good sleep, for example, or I mean, there are certain scenarios where you could carry genetic condition in your blood that makes your blood kind of thick with
I
a tendency to form clots,
I
you know,
see.
or you might have a heart arrhythmia, that you don't know about, such as hypertrophy of the ventricles and one of the ventricles. So every time your heart is beating, it's pumping too much blood. Or you might have suffered from a virus, and the virus attacked your heart at some point and made it dilated. Made it not function well, and you didn't even know that.
Is that like a post-COVID long haul COVID?
Yeah,
really?
It could happen. So the functionality of your heart is not the same anymore, and usually it's two things going on at the same time. You have heart issues and a clotting problem,
I see.
or a carotid problem, an artery issue combined with a clotting issue too. That may be a factor in your blood work that seems to be a little higher than normal compared to the other factors. There are genetics ones. Talking about genetics, there are genetic blood factors, and those we send to hematology, of course, to figure out whether they need stronger blood thinners in order to prevent strokes. But going back to, those are younger folks, but the older folks, then they could be 90 years old, they could be doing great, but age is the one thing that we can't do anything about. And age is a factor for strokes because of the hardening of the arteries over time. The arteries have become hard, stiff, they don't relax anymore. And they get narrow as well. They build out cholesterol plaques because genetically you will codify to build cholesterol plaques at the age of 70, 80, or maybe 90. We don't know that. So it's hard to pin that out.
Sure.
But the older we get, the higher the risk for strokes. And once you get one, then it's even higher.
Then you have even higher of a rate of reoccurrence. Oh,
but the best way to go about this is just, staying active.
Yes.
Avoid the couch.
That seems to be, all the doctors that I speak with, that seems to be the thing. Keep active, keep moving, right? It's so important. Yeah. It's so important.
Prevention, a lot of primary, secondary prevention. You don't think about these things until they happen.
Of course.
And then you're like, oh, I should have,
It's true. So anybody listening, please call in 888-994-4995, Studio A. Dr. Reyes will be answering your questions. I did have a question, Dr. Reyes. How important is it for someone who, let's say they had a stroke or an aneurysm, how important is it that window of time from when they have their stroke or aneurysm to when they get treatment in the hospital? That window of time.
Yeah, it's very important. I mean, that's a great point. The ischemic part, when the vessel is trying to shut down, whether because of hardening of the arteries or high blood pressure, the artery shuts down, and then there's a medication that we can give, which is called TPA. There's a new one called TNK, but we only have 4.5 hours to give it from the time that the patient was completely normal. So perfect scenario would be a patient that had the event in front of their own family members and friends. They call 911. We kind of know they're coming to the ER. We do a scan. We know it's not a bleed, and then they kind of give us green light to give the medication.
Well, that's good to know.
With the hope that it'll clear any clot, any occlusion on the vessel. 30% of those patients do really well.
Good to
they
know.
kind of go back to normal after 90 days.
Good to
About 30% they might stay the same,
Okay.
and 30% unfortunately they get worse. But I think I'll take the 30%.
I mean, listen, if like you said, they're coming in, the ambulance was called, they call in, so why not? I think it's that actress Sharon Stone. I don't know if you're familiar with her. Anyway, she's...
Oh, Sharon Stone,
she had an aneurysm in her 40s.
Interesting,
And she was taken to the hospital. I remember she did a whole, documentary or something on it. And she was talking about how she had that care right away, and they knew what it was. She had a severe headache. She had like you were saying, like the worst headache of her life.
Worst headache of her life.
Yes.
Yeah,
and then
a lot of nausea sometimes.
Yeah, so she had that, and she seems to be functional, normal.
She's very lucky.
Very lucky.
Some patients, they don't even make it to the hospital. The bleed sometimes is so bad that when they find them at home, there's nothing that can be done at that point. So even those patients don't even count into the statistics of the occurrence.
I didn't even think of that.
Yeah. So And yes, so if they make it to the hospital, then they have a really good chance of doing really well. It's about 30% again. But 50% chances of not doing well.
Right.
So you survive the first part, which is the first brain bleed.
Yeah.
Sometimes there is a rebleed, a second bleed from the same aneurysm, believe it or not, within hours. And that's fatal. So we try to move things as fast as possible to kind of going through the groin with catheters and wires and shut down the aneurysm, because it's a little outpouch, a little balloon that bursts. It's full of blood, so you try to shut it down from the inside so it doesn't burst again. So you prevent it from bursting it again. And you're just trying to keep the things the way they are, even though there is blood there.
Sure.
But just try to keep it the way they are. You don't want to get it worse. And hopefully, typically, the body takes care of the blood, little by little, just gets rid of it.
Right.
Yeah.
Because our bodies do want to heal,
That's
right?
Yep, they do want to heal.
It wants
Yep.
to heal, given the right conditions, I would
Exactly.
imagine.
But you got to just put a Band-Aid first,
Right. Right. So I wanted to ask you, what was your, when you were studying to become a doctor, what was it that interested you to be in this particular field? Was there a mentor or somebody that you knew, or what influenced you to become a neurologist?
We're good. Yeah, no, so I had a patient back in original country, Cuba, that transported my patient had a brain aneurysm as well, brain bleed, transported the patient, went with the patient for a procedure. And that's how I learned about the procedure, as a medical student. I was like, wow, okay. So you could really do something about it. Back then, there was not much information about the procedures regarding brain aneurysm, except in the U.S.
Right.
But
I was going to ask you, how
yeah.
advanced was Cuba as far as that technology?
They would do diagnostics,
Okay.
Diagnostics meaning not fixing the problem itself, but they will do the diagnostic part of it. And then in Dominican Republic, then they were actually repairing aneurysm. Yeah. So I met Dr. Suazo there. He was actually the first neurosurgeon coming from Argentina, training in endovascular procedure. And he was probably the first one, actually. I think he's the first one doing endovascular procedures in Santo Domingo, Dominican Republic. Yeah.
Nice.
So he mentored me. I did my thesis on it.
Nice.
On brain aneurysms.
Nice.
And here I am. So
yeah, that's, I always like to ask, because there's usually a mentor or somebody that you really.
There is a mentor.
Yeah. So we have a quick commercial break. When we come back, we'll finish that conversation.
Great, thank you.
Okay.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
That's so funny.
Welcome back to You and Your Doctor. And we are here today with Dr. Reyes. And I want anybody to call in, anybody who's interested. 888-994-4995, Studio A. He is an interventional neurologist. So a couple of quick questions as far as, let's say, early adult onset ADHD and dementia. Maybe those are some topics. Do you see any, it seems to be that more adults are realizing, oh, I have ADD, or I did a test, I have ADHD. Are they coming to you maybe wanting to know more about that, or what is your experience?
Yeah, I see more than I thought so, because patients, they don't just come for stroke most of the time. They will come for stroke, but they'll also have headaches, or migraines or memory problems.
Yeah, we're going to talk about memory.
So when they open the box of memory problems already, I'm thinking, okay, could there be some early dementia? Is there something that I could do for them and kind of guide them into the route? We do have a memory specialist in our office.
Good. They'll do an assessment there. You can do an assessment.
Yeah, and he's have new trials going on too as well for memory. So he's trying to enroll mild cognitive, early dementia cases, early memory problems. But it's funny because these memory conditions we might actually be confusing with early ADHD, which is kind of a different subject, completely different subject.
Yeah.
But they seem to be colliding in a way.
Interesting.
Yeah, so ADHD in the adult, it's never been diagnosed that way. It's usually in a child, right?
Yes.
Think about ADHD, it's a child problem.
But I
It's a
think
kid
what's
problem,
happening, if I can interrupt you really quickly, I think what's happening, there are a lot more places online where you get an alert. Do a test right now online. See if you have adult ADD or ADHD.
That's right.
So I think more people are like curious, like, oh, do I have that?
So that's right. So maybe I don't have dementia. They might be asking themselves, right?
Yes.
Maybe I just have ADHD. So, and it's funny because they can have, attention deficit, which kind of happens in memory, dementia problems. They're forgetful. I mean, duh.
Yeah.
They're losing.
Yeah.
They're losing stuff. They can become a little bit fidgeting about things. I mean, they can have anxiety issues. They can have sleep problems. And some of those things we see them in memory problems, right?
Sure.
Same token, somebody that has depression and anxiety, if they're taking medication, they can have memory problems.
Oh, interesting.
Because medications, they might not be working well for them, and depression is a factor for memory problems too. So all these conditions are interconnected in a way. But ADHD, it seems to be more linked to someone that was already diagnosed with ADHD when they were a child. So 60% of those patients had ADHD when they were a child. So it's almost like what happened in their past, it's actually coming back to life as they're getting older. So I was ADHD before, I was able to overcome it, did well, but now it's coming back. So that's kind of the feeling. It also seems to be obscured or masked by somebody that has a high IQ.
Oh.
Yep, if you have a high IQ, you can mask those symptoms very well.
Okay.
You can get by. But once it's affecting your social life, your work, your friends, your family, it affects two of the environments. If it affects two of those environments, then it's automatically a problem.
Right.
It's a problem, and then it needs to be addressed.
Okay.
Yeah.
Good.
And then that's what, you want to start with the healthy part of our lifestyle. So again, diet, of course, exercising, sleep hygiene.
Important.
Yeah, sleep hygiene.
Important.
If you don't get your rest, 8 hours sleep, those chemicals in your brain, they're not recharged. The sleep is so important.
Yeah, and they even say like a couple hours before, like stop the phone and the blue computer, like
don't have a large meal before, or alcohol
Yeah.
to go to sleep. I'm gonna drink alcohol to go to sleep. I mean, that might not sound good idea. Or a
Yeah.
large meal, you know.
Yeah.
Not coffee. Can't have coffee.
Right.
So yeah, and then you try to do what you can with those lifestyle changes, and then of course that you adjust coping mechanism with behavioral therapy, meaning you go to psychologists, try to get some advice, and then there's medications, of course, you know, but
Sure.
like amphetamines, you know.
Wow.
Yeah.
So, Doctor, we have about 2 minutes left. Can you just share with us maybe what makes the doctor-patient experience unique at your office?
Oh,
Because I know it's unique. So maybe you want to share with us a little bit about that in the next 2 minutes.
Well, like I said before, I mean, most patients, they come for a condition, they come with an idea. I'm going to see Dr. Reyes for, I don't know, brain aneurysm. But they come to me, and I see them as a patient, you know. I don't see them as a brain aneurysm in front of me.
You treat them as a whole person.
As a whole person. So I go through the whole past medical history. What's happening with you? High blood, what conditions that you have? High blood pressure, cholesterol. How are those things, you know? What is your lifestyle? What is your diet? What is your exercise looks like? And then if they have some other issues like, you know, depression, anxiety, or maybe they have sleep problems. If they have sleep problems, automatically it clicks for me. I'm going to try to send them for a sleep study.
I see.
You know,
Yeah.
because if I fix the sleep, I might be able to fix some other things as well.
So true.
If I'm able to help them with, you know, and guide them into addressing some of these conditions, then they might feel overall, it might feel better. And you know, I feel all of them interconnected. You know, sleep is so important. Sleep apnea can cause your blood pressure to go high.
Oh, true.
Your cholesterol too, your sugar. You can have headaches.
Yeah.
You can have memory problems. I mean, they all seem to be interconnected in a way. So yeah, I'd see them as a whole picture. You know, just not see them as a brain aneurysm or a stroke. You know, and try to help them as much as possible. Yeah.
Thank you so much for coming to the show.
course.
I'm going to give your number again if anybody's out there and they need to see Dr. Reyes, an interventional neurologist right here at Palm Beach Neuroscience Institute. Please reach out, 561-499-7551. Thank you so much for coming back to the show.
Thank you. Of course.
Pleasure.
Thank you for having me.
Of course, anytime.